The open enrollment period started this week, and this is your chance to assess and adjust your health insurance plans. Given that everyone's health needs vary, it's really important to know what to consider when choosing a plan. Select Health is here to help with tips to guide you in finding the best plan for you. We're joined right now by Trent Nate. Trent, so good to see you.
Likewise. Thank you for having me.
All right, so let's bring everybody up to speed. Tell us more about Select Health because it is open enrollment.
It is, just began. In terms of Select Health, we're actually a nonprofit health insurance company that serve over 1 million members in 4 states, including Idaho, Utah, Colorado, Nevada. Just celebrated 40 years, and our mission really is to help people live the healthiest lives possible. I think the most important thing for me is that we live and work and play in the communities that we serve. So we have a local office here, we've got one in Idaho Falls, and so we're really happy to be here and to provide great quality insurance.
Wonderful. Okay, dates are very important when it comes to open enrollment.
Absolutely.
Share those with us.
Yeah, so open enrollment started October 15th. It generally goes to December 15th, but this year, December 15th is on a Sunday, and so the last day is December 16th. You get one extra day if you're a big procrastinator, although I don't recommend waiting that long.
Don't do that.
Yes.
Because there's a lot to cover and understand when it comes to your health coverage. Let's help our viewers kind of go through some of that list. What are the things they really should be keeping in mind when looking for the right health care plan for their needs?
A lot to consider.
Yes.
Try to break it down into some simple things. One, figure out exactly what your tax credit might be.
Okay.
That's going to lower your monthly premiums, which is a big deal. Second would be network. Make sure that the doctors that you want to see are in the network on the plans you're looking at. Third, prescription drugs. Want to make sure your prescriptions are covered if you're taking any. Also, the plan design is going to meet your needs. So deductibles, coinsurance, those kinds of things fit your current needs and desires. And lastly, a lot of plans have extra things like virtual care, maybe out-of-area coverage, even wellness incentives.
Okay, and speaking of wellness incentives, cost, right?
Yes.
We're all feeling the pinch right now, especially when it comes to rising cost of, groceries, gas, other things coming into our play that we try to, make sure that we can include in our daily lives, but those costs are just continuing to increase. How can our health coverage, though, help us when it comes to offsetting what I like to call the reallocation of funds, right?
For sure. Yeah, cost is not a fun topic when it comes to health insurance, right?
Yes.
So the good news is there are a number of ways. I mentioned those tax credits earlier.
Okay.
About 80% of the folks that enroll on a plan through Your Health Idaho qualify for a tax credit, which lowers your monthly premium. That's a big one. But there are some other ways as well. Prescription drugs are a real cost driver for health insurance today.
Yes.
And we've tried to implement and provide a number of different programs and tools to really lower cost for your prescription drugs, including Mark Cuban Cost Plus partnership. And then lastly, I mentioned the wellness incentive. We do something really unique where we reimburse towards a gym membership. And so if you're going to the gym or you want to start going to the gym, we'll pay $240 a year, take care of all, if not the majority of that gym membership.
And that's wonderful. I mean, why would you not take advantage of a gym membership like that, right? Because of the physical and mental health benefits from
100%.
Yeah, it just checks all the boxes. But what if somebody watching is someone who really doesn't go to the doctor very often? They don't have anything really that they're too concerned about. Should they still enroll on a health care coverage plan for 2025?
And hit me with the big questions.
I am.
Short answer is yes. And I'll give you 3 reasons as to why. The first reason is part of any sound financial plan. Health insurance is going to protect you from unforeseen health-related expenses. I was just talking to a very good friend of mine who did not have health insurance, unfortunately, had a pretty significant health event. And in addition to just trying to get healthy, he's extraordinarily stressed about how he's going to pay for these hospital bills.
Yeah.
And so just tough. The second reason is that, excuse me, health insurance is going to help you stay healthy.
Yes.
So all your preventive care.
Like the gym membership.
Exactly. Gym membership, also annual screenings, annual physical. Most of that's available at no cost to you with your health insurance coverage. So that's a big deal. And thirdly, I mentioned some of those extra benefits. Those can be really meaningful. Talked about the gym reimbursement. Which is great, but also things like virtual care, no cost virtual care that can apply to urgent care, primary care, also mental health. So there's a lot of added value that can be gleaned from the plan as well.
Yeah, and in some insurance plans cover, chiropractic, acupuncture. My dad's friend found one, I'm not kidding, Trent, totally serious, covered some rounds of golf. So you never know what you can find out
true.
there, right?
It's true.
But it's a benefit, and that preventative is so darn important because, like you'd mentioned, those well care visits that are covered at 100% of cost on most coverage plans, that helps you stay on top of your health, but also uncovers some things before they get too serious.
That's right.
And when things get too serious, we know that the cost of that is just something you can never afford.
Yep.
Right? Not only money-wise, but also health-wise.
That's right.
So, okay, so how do we keep our viewers healthy and get them healthier by making sure they're selecting the right plan?
Yeah, it's a lot to, like I said, a lot to consider. Make sure you're aware of the timelines, December 16th. The good news is you don't have to do it alone. You can call us directly. We really encourage folks to find and work with a licensed insurance agent. There are a bunch of them locally. They're fantastic. Reach out to them. They'll help you navigate plan options. Also, yourhealthidaho.org is our state-based exchange. They're fantastic. You can shop plans, check in on that. Tax credit, premium savings, so lots of resources available to help you kind of navigate this process.
Yeah.
The other thing I'll just mention quickly, if you're happy with your plan, you don't have to do anything. It'll just renew into next year.
Good to know. Excellent. Trent, thank you so much. Greatly
for having me.
appreciated. Everyone, stick around. More to come here on Idaho Today right after the break.